Hi, good afternoon, everybody. To be fair, in my bio, they did say I am an aspiring politician, so Stella is not here, so I kind of feel like I've taken her place. But I'm sure she's going to be here shortly. Okay, well, thank you everyone for coming. I did originally write something, and then when you wake up in the morning, you've got this long speech, and then you look at it, you're like, forget it, like we're just going to do heart today. But I do have some notes that I'm going to sort of like go backtrack to, and I'm not speaking for like hours and hours. But yeah, here I go. So, Mummy, you're only 15. You may be thinking, what does that entail? Mummy and 15 just doesn't go right. And well, being here today, thinking about young women's health, I think it's important that I prioritize the mental health and the mind health of young women. So over the past years, through my own lived experience and professional experience, I've come to realize that in order to create a strong and supportive healthcare system, we must invest in our local communities. We must invest in our churches, in our religious places of worship, in our non-profit organizations, and into individuals who first-handedly work on the ground. It's easy to think when you hear young women's health that I might be referring to the physical health of young women, which is still vitally important, but instead, this afternoon, I'll be emphasizing on the health of the mind of young women, and that includes myself. I grew up in a household with a single mother who had experienced schizophrenia, and for the majority of my childhood, and still to this day, mental health has never been spoken about in my family home. My father, almost non-existent, he also left the family home, and while I was living with my mother, there was a few occasions where I had to fend for myself. And I feel like some of these factors resulted in me falling pregnant at the age of 15. As I mentioned before, Mummy and the age of 15 does not go well. And in fact, society and stigma has done everything it could to constantly tell me and remind me that I was nothing, I couldn't become anything, and I would never be anything. But what changed was the narrative of my investment of my community. To go into a little background of how I met this community, I cannot help but tell you that of a quick story of a 19-year-old boy that was stabbed to death in Croydon. That resulted in his brother and his sister-in-law creating a community in Croydon, and because I was affected by that death, that's how I met them. From then on, my mind was infused with shattering impossibilities and training my mind to believe that regardless of the negative stereotypes that were associated with young motherhood, it didn't matter. And I was determined to prove everyone wrong, including some of you sitting here today. At the age of 19, I stood as the first local council candidate, and I've also encouraged over 250 young people to consider a pursuit in politics. And since then, I've just dedicated my life to young women across the UK and heavily focused on encouraging and building young women to feel confident, powerful, and fearless. But what we can't deny is that so many young women will and have struggled with their mental health, which I refer to actually the health of the mind, because we know when we say mental health, you can automatically think it associates with things that are negative. But I can boldly say that it's the responsibility of every single person in this room to ensure that they provide safe spaces for young women to feel like they can reach out for help and they can seek support. It's our responsibility as policymakers, health professionals, parents, friends, and many more to remind yourself, and including myself, that the betterment of our healthcare system is relying on us and our call to action. What I would like to bring your attention to is how my community saved me. My community saved me when my parents didn't. My community saved me when my local MP didn't. My community saved me when my social worker missed it. My community saved me when my midwife missed the signs of my mental health deteriorating. And because of that community that I joined at the age of 17, I am who I am today. So if there's one thing that I want to leave with you today, simply is a key contributing factor to a prosperous and better healthcare system in the UK is the investment that each and one of us make into our local communities. It's a collective effort and a collective expertise and passion. And with that, I'm confident we can create a better future for all women within our UK healthcare system. Thank you.